Hi, welcome to our channel. In this video, we will be covering how obesity causes diabetes. First of all, let us tell you a very important fact, that is, if you are living with obesity, and you just reduce 5% of current weight, by implementing the health tips, and some easy methods, in this video series, then, you can reduce a sizable risk of developing many health issues related to obesity. Does obesity cause type 2 diabetes mellitus, or is it the opposite? It is currently accepted that obesity is nearly a global epidemic. The prevalence of childhood obesity in the United States is also rising in a parallel fashion. Obesity is defined as an excessive amount of body fat. Overweight and obese individuals are defined by measures of weight and height that provide an index of one's mass, referred to as a body mass index, BMI. A BMI of 30 kilograms per square meter or greater is the definition of obesity. We have carefully created a series of videos about dealing with obesity, a step-by-step approach. We highly recommend you to hit subscribe button and press the bell icon so that you may not miss our future videos. Now, let's discuss the mechanism of obesity. If one is interested in preventing obesity, it is useful to understand how it occurs. Humans, children and adults, consume protein, carbohydrate, fat, and non-nutritive fiber plus essential vitamins as part of the substrate required for normal growth and development as well as physical maintenance. When more nutrients are consumed than needed, the excess is stored primarily as energy in the form of fat and glycogen. For those who cannot increase their mobility, but they are willing to lose weight without exercise or walking, I have free health tips for you. Just click the link in the description below. You will get all the information free that how to decrease weight by increasing the metabolism of your body. Coming back to our main topic, the major form of stored energy in humans is fat, triglycerides, which accumulates primarily in adipocytes that are located subcutaneously and around organs. Carbohydrate is absorbed from the gastrointestinal tract primarily as glucose, and it is utilized directly by the brain, nervous system, red blood cells, heart, and other muscles as the primary energy source. Excess glucose can be stored in muscle and the liver as glycogen. More commonly, excess glucose is metabolized into fatty acids and glycerol 3-phosphate in adipocytes. These two substrates combine to produce triglycerides, the fat storage form, by the esterification of the fatty acids onto glycerol 3-phosphate. Glycerol 3-phosphate is required to provide the backbone for the production of triglycerides, and it is created inside the fat cells from glucose. Glucose requires the action of insulin for its intracellular transport before it is metabolized into glycerol 3-phosphate. Fats are ingested primarily as triglycerides, which are hydrolyzed by many lipase enzymes, but particularly pancreatic lipase, which releases fatty acids and monoglycerides into the gastrointestinal tract for absorption. The fatty acids are transported with the help of insulin into muscle cells for functional energy and adipocytes for storage as fat. Fatty acids and glucose are the nutrients that are utilized by the body for the energy required to provide muscle function, with the excess being stored in fat cells for later use. When energy is needed from the stored fat, fatty acids are then released by hydrolysis and transported to the tissue that needs the energy. Both glucose and insulin are required for the production and storage of fat in adipose tissue and are essential to establish and maintain obesity. It has also been noted that as fat stores increase and the size of adipocytes increase, the cells seem to be less responsive to the presence of insulin for glucose transport. Without insulin action, one cannot store body fat in spite of excessive nutrient availability, as seen clinically during the evolution of type 1 diabetes. If significant or important insulin resistance occurs in fat tissue, it is manifest as weight loss and reduction of total body fat. Thus, insulin resistance caused by obesity is physiological and acquired in parallel with increased fat mass. Without glucose and insulin, the body cannot make or store fat. The next pathway for excess fat accumulation is when elevated insulin levels occur in response to cardiac and skeletal muscle resistance to the action of insulin. This reduction in the substrate for energy production results in elevated glucagon to increase hepatic glucose production and available supply. The increased hepatic glucose production, not transported into muscle for energy in spite of elevated insulin, seems to stimulate fatty acid release in an attempt to provide an alternative substrate for muscle energy. This first phase insulin response is lost during the progression of patients to overt and constant hepatic glucose release caused by chronic hyperglucagonemia or hepatic insulin resistance. The continuous infusion of glucose from the liver is in response to the continued release of glucagon, which is not being normally suppressed by the elevated insulin levels. The development of hyperglycemia in association with the failing glucose-stimulated beta cell secretion of insulin results in the clinical diagnosis of diabetes and the addition of supplemental exogenous insulin to achieve normal blood glucose levels. The appropriate biologic response for individuals who have inborn muscle insulin resistance is to have elevated insulin, glucose and fatty acid levels to ensure that the heart and skeletal muscle have sufficient energy substrate available to sustain normal cardiac and muscle activity. Thus, individuals who have type 2 diabetes are genetically predisposed to muscle insulin resistance, and therefore, to become overweight or obese. In our next video, we will be discussing, in detail, how obesity causes stroke, and measures to prevent it, as well as meningitis, so make sure to subscribe our channel, and hit the bell icon, so that you may not miss any of our future videos. We will be uploading videos on a regular basis. Take good care of yourself, stay safe, stay healthy always. Leave a comment and hit the like button, this will boost our efforts. Thanks in advance.